The Delta variant is continuing to put significant pressure on our healthcare system. And Alberta's government is working to relieve that pressure by freeing up beds and freeing up resources to deal with the rise of inpatients needing care. Today, we're adding resources for home care and more supports for residents in our continuing care facilities, with the goal of moving patients out of hospital and into more appropriate care settings. Now, first, I'm pleased to announce today that the Government of Alberta will provide an additional $22 million over 2 years to increase pay for certified healthcare aides who are working in contracted home care agencies. And this is going to support retention of current staff and as well help to attract new people and increase capacity in our home care system in Alberta. As well, healthcare aides, it should be noted, are the core workforce in continuing care, including both home care and facility-based continuing care. They're skilled staff, and the work that they do is essential to the well-being of their clients and the residents that they serve. More than 27,000 continuing care residents at any given time, and 140,000 home care clients in a given year. And they've been truly on the front line of the pandemic, along with the staff in hospitals, as well as our family physicians and other health professionals. They've come to work through the pandemic and done everything that they could for their clients and their residents, as always. Second, we'll provide $14 million to support short-term staff increases in home care agencies and our continuing care facilities. Now, we know that home care agencies and our continuing care facility operators continue to face staffing challenges. And with this new funding, AHS will work with operators to find new ways to make staff more available and add new staff where they're most needed for short periods of time. And this important program will increase capacity to handle things like increased cleaning and screening in facilities and respite care and other supports for families of home care clients. Increasing staffing will mean that we can move more patients home from the hospital when they are ready. And that's better care for the patient, because the hospital is only the right place to get care as long as you really need to be there. And it's better for the system and for other patients because it frees up opportunities for a bed for the next patient who needs it. The steps that we're announcing today are just short-term pieces of a much larger effort to modernize our continuing care system. And that effort is guided by the facility-based continuing care report, which we released back in May, if you remember. And the review looked at how we can build on the best aspects of our continuing care system. It also took a look at what we could learn from the pandemic and the toll that it had taken on residents, on families, on staff, and the staff and the operators as well in these facility-based continuing care settings. We know that there's a lot of work ahead of us, but with the fourth wave surging in the healthcare system, coping with this fourth wave, now is the time to move ahead with some of these important measures that will improve capacity immediately. Now, the report from May, this report laid out some ambitious goals, starting with putting quality of life at the center of the system for continuing care, and improving staffing in home care and facility-based continuing care. What that means is that we can add capacity right now to help the system respond to the pandemic. And I want all Albertans to know that the government is exploring all options to ramp up our capacity at this time. And before I turn it over to Dr. Hinshaw, I want to express my personal condolences to those Albertans and their families who have had their surgeries postponed. No one wants to see that happen, but it's a step that AHS needs to take to free up capacity to get through the peak in demand. And as they've done before throughout the pandemic, and other jurisdictions have taken similar measures, AHS will be working to ramp back up and get those patients rebooked as soon as possible.